So you've got a huge presentation in front of your college. You're nervous. You've got quite a bit of stress leading up to the presentation. The stress is completely normal and really probably useful in certain situations since it can make you more alert and careful. Well, for 30% of the population, the stress doesn't go away, and maybe the stress isn't even poked on by a specific event, and it was just sort of there. Either way, at the point of considerance to be anxiety, the anxiety might get worse over the time and cause things like chest pain or nightmares. Sometimes the anxiety is so severe that it causes someone to be anxious about leaving this house or doing everyday things like going to work or school. This anxiety may be a sign of generalized anxiety disorder, sometimes shortened to GAD, characterized by excessive, persistent, and unreasonable anxiety about everyday things like more family or work and relationship. Even sometimes the thought of getting through the day causes anxiety. If the anxiety is persistent, then it doesn't seem to go away. If it's excessive, it's usually more than someone else might feel, and if it's unreasonable, they probably shouldn't have a reason to feel anxiety about that. And people who have GAD may even understand that their anxieties are excessive and unreasonable, but they feel it's out of their control and don't quite know how to stop it. People that serve GAD may be completely debilitated and have trouble with the simplest daily activities, or they might be only middle effective and might be able to function socially and hold down a job. Sometimes the feeling might worsen or improve over time. In addition to having feeling of worries and anxiety, other symptoms include edginess and restlessness, difficulty concentrating, or feeling like the mind just goes blank, and also irritability. Psychological symptoms can also lead to psychological manifestation of symptoms like digestive problem from eating more or eating less. May also have muscle aches and soreness from carrying tension in their muscles. Finally, difficulty sleeping is a really common symptom that can have a serious impact on physical well-being since the body is not resting, and this can lead to issues of chronic fatigue. Although the decision that someone worry it is massive and unreasonable has a subjective body diagnosis. GAD is aided by Diagnosis and Statistical Manual of Mental Disorder, or the DSM-5. This manual gives a list of criteria to meet in order to be diagnosed with GAD. First, the excessive worry and anxiety has to be present for more days than not over the course of the 6 months. In other words, a person should have the symptom or excess or unreasonable worry on 19 or more days out of 118 days. Generally, people can quantify or track their feeling in the way, so again, it is meant to offer a general guideline, right? Second, the person finds how to control their anxiety, meaning that they have a hard time calming themselves or self-soothing to help themselves regain control over their feelings. Third, an adult must have three or more of the symptoms listed previously in children, though typically defined as school age, so between 6 and about 18 years old. Only one symptom is needed for the diagnosis of G. Fourth, another criteria is the of anxiety causes impairment or important daily activities like school or work. For example, they might miss deadlines or find it difficult to even go to work because of their symptoms. Fifth, the symptoms are not attributable to their psychological effect of drugs or medication or due to a medical condition like hyperthyroidism, which creates an excess of thyroid hormone, which can sometimes cause a symptom of anxiety and worry. Finally, their anxiety isn't better explained by another mental disorder like social phobia or panic disorder. It's like a lot of mental disorder, it's unclear exactly why some individuals develop generalized anxiety disorder. But it's not to be a combination of genetic and environmental factors as it seems to run in families. It also has been shown to be twice as prevalent in females and in males. Treating GAD, like many mental disorder, may involve psychotherapy, medication, or a combination of the two. If it's psychotherapy, cognitive behavioral therapy has been effective since it teaches the patient to think and behave in different ways and react differently to situations that should usually causes anxiety and worries. Medication like benzodiazepine or antidepressant by prescribed as well. Benzodiazepines are the other type of psychoactive drugs that have a relaxing and calming effect. Antidepressant may also be prescribed like selective serotonin reuptake inhibitors or SSRIs, which really get the serotonin level in the brain and help elevate mood. Even though both medication and cognitive behavioral therapy are similar in short terms, candidate behavioral therapy has major advantages over medication in the long term due to the unwanted effect of the medication like tolerance, defense, and withdrawal.